women's journey. It is not a disease. It is a natural biological process that reflects the health of the women. So every girl is unique, her menstrual cycle is unique, but slight variations are normal. Only slight variations are normal. Modern system explains elaborately about the menstrual cycle. There are 4 phases. It explains the physiological process of the menstrual cycle in 4 phases, namely the menstrual phase during the first 5 days of the bleeding, where the endometrium is shedded throughout the bleeding cycle. The second one is the follicular phase, which happens from 6th day to 14th cycle. As the estrogen hormone rises, a dominant follicle matures in the ovum, and in the ovulation phase on the 14th to 20th day of a menstrual cycle, a dominant follicle or the ovum is released from the ovary, where the chances of the fertility is highest. It happens due to the triggering of the luteinizing hormone. And the 4th phase is the luteal phase, where the ruptured follicle becomes the corpus luteum and it produces progesterone. If there is a chances of pregnancy, then there will be a growth and development of the endometrium for the preparation of the implantation of the baby inside the uterus. And if there is no chances of pregnancy, the hormones fall and the next menstruation, that is the bleeding, begins. This is all about, in short, about the menstrual cycle, which the modern science explains us. In Siddha view of menstruation, menstrual health depends upon the healthy nadi, as the Tirukural quotes, Miginum Kurayinum Noi Seyum Nulor Valimudalai Enniya Mundru. Healthy nadi, in the sense, it is the healthy Uyir Tadukal, Vali, Alal, and Ayam. So it relies on the different types of the physiological heat which exists in the human body, which is mentioned in the many of the Siddha texts which exist in our body, namely the Udal Sudu, Mula Sudu, Mega Sudu, and Garba. Udal Sudu, it directly means a body heat. Mega Sudu, it depends upon the heat that prevails in the genital around the reproductive system. And the Mulachudu, it describes about the heat in the anorectal region. And the Garbhasudu, it explains about the heat which relies in the uterus. So all the maintenance of the physiological heat in the body in turn contributes to the healthy nadi. When these physiological heats are altered or disturbed, they in turn brings about the change in the dasa vayukal, and thereby affecting the 7 udal tadukal mentioned in the Siddha system of medicine, namely the saram, sennir, wound, kulupu, enbu, mulai, and shiklam. It in turn brings about a big impact on the uyir tadukal, vali, alal, ayam. So hence a healthy pulse contributes to the healthy menstruation. It means the normal physiology of the heat quoted in the Siddha principles for their normal state. So what does the healthy nadi means in terms of our daily routine and lifestyle? Healthy menstruation depends upon healthy nadi. So how it happens? It happens our accumulation, the piling up of a good nutrition, good digestion, the balanced hormones, the peaceful mind. In case of working, it means the work-life balance. In case of studies, it becomes a study-life balance. So for all these things, a good lifestyle and a routine is recommended, which means a good sleep and wake up routines. It means from 6 to 9 hours of a good sleep and getting up early in the morning, and physical activity, meditation, purgation, and the mindful eating. All these things contributes to the healthy nadi, which in turn contributes to the healthy menstruation. So all about menstruation, it naturally ends up fertility, healthy baby, and healthy womanhood. Speaking about the fertility, only with the healthy body and mind and healthy physiology and healthy nadi, there will be a normal pituitary ovarian hormonal axis. All the hormones will be in harmony. In the healthy endometrium, there will be a healthy endometrial development, healthy follicular development, a normal ovulation. And when it comes to pregnancy, there will be a good implantation and zygote formation and good implantation. And further, the 9 months of healthy pregnancy, and at last, you will have a healthy baby. அதாவது a good work turned up at each moment, piling up of the good work turned at each moment will bring about a great change. Likewise, a healthy menstrual cycle from the menarche, and before that from the early childhood, a good routine will build up a good menstrual cycle, and a good menstrual cycle will build up a fertility chances, and we will have a healthy reproduction and a healthy generation. Next one, why the menstrual problems occur nowadays due to the poor diet, which is not based upon the nutrition or anything else. It is up to the taste of the people, relying to the tongue and their taste. There is a poor diet. What we eat in our plate, there is no mindful eating. What we eat, it contributes to our health, but no one is relying on that. So poor diet and excessive body weight and irregular sleep, stress, irregular sleep mostly due to long hours of using the screen time like laptops, your mobiles, addiction to the social media, and anemia, vitamin deficiencies, sedentary lifestyle, hormonal imbalances, hormone medicines for personal causes. Like this, people are for the some going to temp for plan if they plan for a sacred things to happen at their homes, or if they are planning for a temple visits, they used to take hormonal medicines to stop their bleeding or postpone their bleeding. It is a very bad habit. All these things will pile up, and of course, the PMOs, the polycystic ovarian syndrome, has been now named as PMOs. So that one also, all these things will disturb the உயிர் தாதுக்கள் வலி அலல் iron IM, leading to the irregular menstruation and the piling up of all the menstrual disturbances like more pain, heavy bleeding, scanty bleeding, fatigue, mood changes. Sometimes all these can end up in infertility also. So, what are the common menstrual problems nowadays the women are facing? First one, I would like to address upon the premenstrual syndrome. Premenstrual syndrome, it is some signs and symptoms which happens in a woman or a girl during her uh, the luteal phase, that is before the periods occurs, some 10 to 1 week before the periods, she will be suffering from many mood swings like irritability, chest or breast pain, white discharge, abdominal discomfort, many discomforts in her legs, lower back, and abdomen. These are the premenstrual syndromes. The second thing is the most common one is the anemia. It is a very common condition contributing to the menstrual problems and the overall ill health. They will suffer from no periods or extended cycles, some 10 to 15 days of their bleeding, contributing to fatigue, dizziness, poor concentration, etc. And speaking about amenorrhea, so amenorrhea in the sense there will be no periods. 1 or skipping of 1 month cycle or 2 month cycle, naturally it is a biological process due to some disturbed hormones or disturbed lifestyle. But more than 3 months of no periods, it is amenorrhea, it contributes to a menstrual problem. It has to be treated well. And the fourth most common thing is the dysmenorrhea, the pain during the periods. The painful contractions during the periods adds more to the trouble. So the release of the modern science discuss about the prostaglandins, which increases the uterine contraction and in turn increases the pain. But in synthetics, it is due to the it describes due to the alteration in the garbhachudi. It in turn brings about the change, and we call it as sudhaga vayu. So adequate sleep and rest and necessary medications are prescribed for these painful periods. Irregular periods in the science, the menstrual cycle will be occurring for a month, and it will be absent for 2 months, and it will be there for 3 months. So regular cycle will be so on and off irregular periods can be a cause of some PMOs or stress or increased weight. And another most common problem we are here to discuss is about hypothyroidism due to the changes in the thyroid hormones. It has become a very common thing now. And apart from hypothyroidism, another thing is the TPO antibodies, like thyroid related antibodies are also elevating nowadays. So it has become a very big problem. It not only stands like a menstrual problem, it is affecting the fertility also. So all these things has to be treated. So what Siddha system recommends? First, I like to start from the lifestyle modifications to avoid ultra processed diet, sugary drinks, excess of junk foods, excess of non-veg, which is bought from the stores and shops, and the second thing, the diet which should be added are the traditional millets in the raw rice, sesame oil, refined castor oil, palm jaggery, dates, figs, pomegranates, amla, sesame seeds, urad dal, fenugreek, greens, moringa leaves, banana flowers, that is walapu, eggs, sprouted legumes, bony soups, and the liver and spleen of the goat. So in the Siddha lifestyle recommendations, we are recommending sesame seeds, urad dal, and fenugreek throughout the menstrual cycle. That is from 1 to 5th day of the menstrual cycle, sesame seeds can be taken in the form of a powder or sesame laddu or yellow danam, in sesame seed rice, fried rice. From 6th day to the 14th day, we are recommending urad dal, and from 15th day to 20th day, we are recommending fenugreek, vandayam. This keeps the estrogen and progesterone in a normal state, helping a good menstruation and a good hormonal balance. So we discussed about the anemia. So to correct anemia, we can choose dates, figs, and amla, like bony soups, and the liver and spleen of the goat will help more in improving the situation of anemia. And for painful periods, heavy bleeding, irregular menses, and amenorrhea, the continuous use of these sesame, urad dal, and fenugreek in the days recommended, along with the sesame oil, castor oil, and the traditional millets and the raw rice, it will help in maintaining the normal menstrual cycle. And the second thing is about yogasanas. We would be recommending, there are a few pictures I think you will be seeing. A friend right from above. The first is the Brahmari Pranayama. We highly recommend this for reducing the stress and to lead a peaceful life. We usually recommend to patients to do it before going to the bed, 10 to 15 minutes. And early morning, while you get up, you just brush and finish off your restroom habits, and you can go for this Brahmari Pranayama for 10 minutes. It will give you a very good peace of mind. So, the stress-free life and balancing your personal and the social life, it will be helping in keeping a peaceful mind. So for overcoming stress, we highly recommend Brahmari Pranayama before going to bed and early morning. The second one is, you can see it as Sitali Pranayama, just inhaling, we are inhaling through the mouth with a tongue twisted like in the photo. It helps in reducing the body heat. And the first three from up to down, first three, that is a cobbler's pose. We call it as Baddha Konasanam, in the sitting posture, in the lying posture, and bending down. It helps in reducing the urinary tract infections. And if you're doing it for a very long time, practicing for many years, there will be a reduction in there will be a reduction in the varicose veins, and there will be a prevention in getting the varicose veins in the later on stages of after 50 or 60. There will be no developing of the varicose veins when we practice Baddha Konasanam along with these three steps and along with the butterfly exercises also. Another two asanas we highly recommend for healthy menstrual cycle and healthy harmony of the hormones, and to prevent infertility and all the menstrual problems. We highly recommend the first one, the first one, the Halasanam, the down, Sarvangasanam, and the below two with Pavala Muktasanam. These helps in keeping the hormones in harmony, and it helps to, if practiced regularly, it will help in maintaining a good menstrual cycle, and everything will be a normal thing. And the last two thing above, You can see it. It can be done in a Vajrasana or in a sitting posture also you can do. It is called as it mainly concentrates the oxygen level at the throat, in turn helping the thyroid to bring it back to the normal level. So these are the asanas we would recommend for a healthy menstrual cycle. Okay, when talking about the unique body needs and the pain and the bleeding management, for unique body needs during a menstrual cycle, people need rest, a good sleep of more than 6 to 9 hours, a good peace of mind, a warmth from both the family and the space they are relying on, the energetic liquid foods. Speaking about the pain management, there is a dysmenorrhea. Commonly, cold fermentation at the lower abdomen, or castor oil application, the lower abdomen, or a wet clay applied over the cotton cloth and applied over the lower abdomen. It helps in reducing the pain during the periods. Otherwise, the clove or sombu perinjeeragam decoction will help in maintaining the pain during the menstrual period. But in case of pain shock, continuous medical management has to be done so that the pain shock reduces gradually in from 3 to 6 months. For bleeding management, the simple thing is we have to just rest. You should not move, just lie down. It will help your uterus to get rest, and it will have some space for the reducing the contractions, and the bleeding automatically slows down. And for equating the bleeding during the menstruation, whether the bleeding is in a normal thing or a heavy bleeding, you can have some pomegranate juice or a drink made of pomegranate. It is Madulai Manapagu, so that your bleeding will be equated with the drinks you have. Next, about the home remedies. We were discussing about in past few slides, we discussed about the irregular periods and the painful periods and amenorrhea, painful menstruation, all these things you can, what are the home remedies we can do is you can, here are some list of few medicines you can prepare it at home. That is Kumari Pakkum. It is a jam like thing where the aloe vera leaf pulp is washed 7 times. With that, palm jaggery and garlic paste is added, and it is cooked well to a jam form. 1 spoon of it from morning and at the night for 3 to 6 months. It will help you get your regular periods, regular menstrual cycle. It will reduce your heat. It will reduce your white discharge. It will reduce your pain in the abdomen. But it is a basic medicine. It can be prepared from your home, and it can be used. But once if 1 or 2 months it has been followed, and if there's no improvement, you have to approach your doctor nearby. And the second one is Madulai Manapagu. There is pomegranate juice is to be taken. Equal amount of pomegranate juice and palm jaggery or mixed well along with a few cardamom powder. It is mixed well and cooked well till the pagu padam, that is kambi padam, like we call it as, till that. And it has to be taken with water, normal water, 5 to 10 ml with normal water. It Madhulai Manapaki in turn brings down your body heat. It will increase your hemoglobin content of your body. It will give instant energy during your periods. It will help in reducing your pain and everything. And the third one is dysmenorrhea. For dysmenorrhea, for pain, you can have a sombu decoction or a clove powder, fried clove powder equal mixed with equal amount of glucose powder. You can have it a 1/4 spoon or a 1/2 spoon. It will reduce the menstrual pain in some 10 to 20 minutes or so. And for irregular periods, or if you're having any white discharge or irregular cycles and painful menstruation, all these things, you can go for purgation with the refined castor oil. So nowadays, this Utrina and I mentioned in the Siddha textbooks are not available. So you can get the cold compressed castor oil, which has been available in the shops, and the equal amount of adding equal amount of tender coconut water and chopped small onions to chop. You have to boil them well. So when the onions get fried, you can filter it out and you can store it in a bottle. Purgation of some 5 to 10 ml of this refined castor oil with tomato rasam or any soups during your cycle time at the second day or third day. It will help you reduce all the common menstrual problems we discussed here. These are the home remedies. And now we are moving to the red flag signs when you should consult a doctor, even though the home remedies are meted out. We here highly recommend the home remedies for only the slight variations in the common menstrual problems we discussed here. But when it's a red flag sign, that is, the period is absent for more than 3 months. If bleeding is more than for 7 days, and your heavy bleeding is there, that is more than 70 ml of blood loss. That is more than if you are using some 5 to 6 pads, full pads, full bleeding in the pads of 6 to 7 pads. That is a very large bleeding, and sudden uterine contractions with the release of large blood clots, the severe pain which is not relieved with the simple measures. That's a pain shock, the severe anemic symptoms and suspected PMOs, pregnancy-related bleeding, fever with menstruation, or a white discharge with sounds, foul smelling, or any itching or something in the external genitalia which is not healed by the home remedies, then you should consult your doctor, the physician nearby, or a good gynecologist nearby, and take immediate actions. Talking about the Siddha system of medicines, you can get cured with the Siddha system of medicines without any ill impact on the physiology and hormone. That is the best thing which Siddha system contributes to the women's health. And I would like to emphasize on some take-home messages. That is, healthy menstruation means healthy life, and we have to remember 7 golden rules. Get eating nutritional and traditional foods, staying physically active, sleeping well for some 6 to 9 hours a day, managing stress, maintaining a good menstrual hygiene, avoiding self-medications, and seeking medications seeking medical intervention once the once the problem is identified. These are the 7 golden rules for a healthy menstruation, which contributes to the healthy life. And last thing, the menstruation. I like to emphasize that this menstruation is not merely a monthly event. It is a biological process and a part of a womanhood journey, which reflects the overall health of the women. So the system of medicine teaches us when the body, mind, and lifestyle remains in harmony, menstrual health naturally flourishes. So by combining the timeless wisdom of Siddha with modern scientific understanding, we can empower every girl and woman to live a healthier, happier, and more confident life. Thank you. Thank you everyone for your time and space. Thank you, Global Center for Siddha Medicine and Research family, Health India Foundation family, and Ulaga Tamil Martho Kadagam. I would like to thank Dr. Michael Jairaj sir and Dr. Salvation sir for being the pillar of support throughout the journey. And thank you. I'm now ending the session, and I'm calling out for the questions. Thank you.
Thank you very much, Dr. Satyavati, for the very informational talk. So now I open the floor for question and answers. You can raise your hands or post in the chat so that we can call everyone. Thank you.
Dr. Rama, can you hear me?
Yes, doctor. Yes.
Yeah, this is Dr. Satyavati. Thank you very much for the detailed presentation. I'm going to make a couple of comments and maybe a question, one or two. I enjoyed listening how you talked about from the Siddha medicine perspective, whole menstrual cycle. You talked about premenstrual syndrome, even polycystic ovarian syndrome and menopause and thyroid health. So it is very informational. The take-home message for me is how the lifestyle can change, and talk about amenorrhea and several things you talked about. And finally, you ended up your talk with the 7 golden rules. Given all of this is very impressive. The lifestyle change can do so many things, and it is so comprehensive. So I want to come to the practical matter. You practice Siddha medicine in Chennai, is that correct?
Yes, sir.
Okay. So, how do you take your patients through lifestyle change? That is a huge aspect. Dr. Silva can tell you about this too. He's trying similar thing, not from the reproductive system point of view, but from the healthy life in various ways. Now, there are two challenges you have. One is taking the student, I mean, your patients through lifestyle change. Just listening to you, a lot of people would not be able to do. So, number one, do you have a systematic way of teaching them, maybe like a workshop or something? I'm not sure exactly how you do with your own patients. And then I have a couple of questions related to some of these things you talked about. Can you respond to my lifestyle thing? How you walk your patients through and how you bring this habit for them? Go ahead, please.
Dr. Satya, are
Thank
you?
you. Yes, ma'am. It
Okay.
was a very long question. If you split up the questions and ask, I think I would be able to answer that, sir.
Yes. The first question is simple. There are a lot of lifestyle changes you mentioned, whether it is a PMS or PC. You didn't talk much about PCOS, but you talked about menstrual bleeding. So, and then you also mentioned several things about remedies, including home remedy, or they have to come and see you when it is serious enough. So, my first question is simple question. How do you bring this lifestyle change in your patients, other than giving a
Is
talk?
in our clinical setup, we go for first counseling. So how to change their food habits, how to change their wake up and sleep routines, how to indulge them into practicing of physical activity like including a yogasana or any other game activities into their regular life, like just like brushing, how the brushing and bathing and fooding for having food habits. So we are bringing, indulging the physical activity also. After that, only we insist upon taking medicines. So altogether, we don't start for heavy bleeding. We start the medicines immediately. But when a patient comes, when a 14-year or 15-year girl comes with a menstrual problem, we just have for a counseling. We help them go for physical activities, correct their lifestyle modification. Then only we start giving medicines.
Now that's good. That's good. So you are able to educate them as you are telling therapeutic
Yes, sir,
approach.
because our
Go ahead.
main aim is it is patient centric. It is a long journey. We bring about the awareness in the patients so that there is no need to meet any doctor in the future also.
Oh, I like that. I like that. And also, if I understand you, what you are saying is right. Your patients go through steps, including
Yes, sir.
lifestyle changes, food
Yeah,
habits, and whatever else go with that. That's
including the
good.
physical activity, and the third step is the medicine.
Yes, yes,
So
of course, of course.
why there is a problem? So we are first treating the problem. These are the problems which is creating the disease condition. So we are educating them with that thing. So resolving first that problems only when will help us treat the medicines. Otherwise, if I just treat the condition, they will be coming to the clinic post some 3 to 6 months. While
Thank you.
educating them, bringing about the awareness and indulging them in all these practices and lifestyle modification, we help them throughout the journey. They will be correcting all those things and having a disease-free and a holistic lifetime.
Yeah, thank you so much for going through that. I like that approach you talked about. I have one more question, Dr. Rama. Do we have time?
Sure, doctor.
Yeah. Dr. Satyavati, now the question
Yes, sir.
is, which you may not be able to answer in a short time we have, but I
Okay, sir.
was happy to hear, even through Siddha medicine with the lifestyle that you are proposing, thyroid health also
Yes, sir.
can be
Yes,
dealt
sir.
with. In other words, you can keep, unless there is a pathological side. To me, it
Yes, sir.
looks like for thyroid health, your lifestyle changes
So there
also
are
are very
there are
helpful.
there are many remedies related to this treating this thyroid conditions. For earlier, this hypothyroid conditions, very small term, some 2 to 3 or 6 months medications is enough, along with the lifestyle modification like Sangumuttirai, then there is Halasana, Sarvangasanam, and Singhasanam, along with the medications which is being used to correct the that Sudaga Vayu, right, the Garbhachuda in the uterus. In simple terms, we can call it as maintaining the pituitary ovarian hormonal axis. It brings about a great change. They will be we can avoid taking the thyroid medicines throughout the entire life. We have some 5 to 10 more patients who were suggested for removal of thyroid, but due to the TPO raised TPO antibodies and also things, but the conditions were reversed along with the integrated treatment. So it is possible to treat more thyroid related problems and prevent patients from getting surgically removed and suffered without the thyroid gland throughout the life. We
Yeah,
can
just a
remove some
follow.
more fertility problems also by resolving this.
Follow-up questions. With the thyroid, you mentioned about hypothyroid and you talked about hyperthyroid from the perspective of removing the thyroid itself. Now, the
Okay,
question
sir.
really is if you are not giving for example, hypothyroid, if you don't give the exogenous thyroxine treatment, synthroid is the one we do modern medicine. So, without replacement, you are saying even hypothyroid, low thyroid condition, without giving a replacement hormones. Are you saying you have a way of treating so they don't have to take thyroxine at all? I
It
mean
definitely
synthroid at all?
it definitely depends upon how long the patient has been suffering. So it is whether it is a newly diagnosed thyroid patient or they have been in a long-term intervention for thyroid and they are coming to the visit. So it depends upon if you're early diagnosis and they are coming directly for Siddha intervention. It is a possible thing to cure and put them into lifestyle modification and medication and get their thyroid profiles to normal. But when they are on a long period of thyroid medications and after that they are coming, then it is a very big process. They have to continue it for more than 6 months to 1 year or 2 year. After that only we can, along with their physicians help, allopathic physicians help in maintaining the thyroid. Simultaneously, integratively, Siddha medicines is also given by us. So integratively, it is treated and the result is achieved.
Yeah, Dr. Satyavati, thank you so much for your not only for presentation, taking time to go through this. I think you have a
Okay.
great opportunity of publishing all the work you are doing. And I have some more questions. What I would do is, if there is a way that we could talk to each other, we will do it later on. But
Yes, sir. Sure.
thank you so much, Dr.
Thank you,
Rama.
sir.
Thank you very much.
Thank you,
Thank you, sir.
doctor. I can share Dr. Satyavati's information so that you can connect with her offline. Thank you,
All
doctor.
right. Thank you.
There's a question from Jagadish Ramaswamy. He says this is a great informative session, and he has questions about endometriosis. Have you seen diagnosed endometriosis patients?
Yeah, it
Is there
is.
any specific herbs that works effectively?
Yeah, one common, there are so many medications to treat endometriosis, and likewise, I said there are quite a lot of medicines in Siddha system, but specifically, you're asking about herbs. In our text, Gunapada Moolige book, they are explaining about Kalyana Murungai or Mulla Murungai, in botanical name Erythrina indica. That's flower powder of that flower, dried flower. It helps in treating this endometriosis problem. The text explains like ratta kunmam வெளிப்படாத இரத்த குன்மங்களும் குணமாகும். So but it is the forming of the endometrium and the shedding of the endometrium purely relies on all the pituitary ovarian hormonal axis. So not only this Kalyana Muringa leaf powder or the flower powder, but also the using Parcasium medicines like Malayvembati Thailam, which has been advised to be followed during the menstrual cycle for 2 to 3 cycles. It will help in maintaining that hormonal axis in terms of Siddha, maintaining the Sudu and Vayukal, and maintaining the Uyir Tadukal. It helps in reversing the endometriosis completely. It is possible to reverse with the right medication, right lifestyle modification.
Thank you, Dr. Satya. Now I invite Dr. Shankari. She has raised her hand.
Thank you, Dr. Rama. Dr. Satyavati, a great presentation and great talk. And I think people don't realize the value of our traditional Siddha way of life for continued good health. And the 6-part series is great. I hope more people, women will join and get benefit. This is a general question. So when we go to India, we all buy a lot of the supplements, Siddha supplements, and for general health. My question is, I think of herbs as long lasting, but when you get all these products, there is an expiration date, and like the allopathic medications. And what is your theory as far as use before this time? Because all these processes of Siddha process of pharmacologically is a little different. And what is your recommendation when you buy the supplements for general well-being?
Okay, for general well-being, for related to women's health or overall
related
health?
to women's health. Related to women's health. Like my question is, when you buy these supplements from IMCOPS or SKM, they always have a expiration date.
Yes,
So is it truly? I'm just curious, because there are always theories that these are driven by the companies that make people buy again. But I know, like when I've gone to centers, they use these oils for years together, right? The processing that happens in integrative side, the processing is so good that they are preserved for a long time. So my question is, what, from your Siddha perspective, what does it mean, the expiration date? Does it change its biological component, or is it ineffective, or do you recommend people to throw it off?
While speaking about the expiry dates of the medications, Siddha system of medicine speaks about internal medicines, that is Agam Marandu 32 and Puram Marandu, there is external medicines 32. This is the classification, and for this Agam Marandu internal medicine 32, they are mentioning the expiry dates in a poetry form. So starting from surasam, that is expressed juice, and indirectly heating the expressed juice, like it is called as surasam. And from that to legium form or neigh form or powder form, all these medicines for up to this thin distillation process, there is a set of expiry dates. Speaking about the expiry date of some 75 years, it includes Chenduram, and more than 50 years, it becomes Korambu, Melugu, Chenduram form, and Parpam form or Chunnam form. But all these Parpam, Chenduram, Chunnam, Kurambu, Melugu, all these are metallo-mineral preparations which should be taken only under the prescription and advice of the Siddha physician only. There is expiry dates where the medicine gets its efficacy gets low, its beneficiary effect will go down, and it will be not in a consumable form. Starting from the first 16 sets of medicine, from this juice to legium, churnam, that rasayanam, ghee form, there are some expiry dates, very low expiry dates. Some if speaking about the decoctions, commonly in the Nilavembu Kashayam, after preparing, once you prepare the Kashayam, it will be expiring in the next 3 hours. So Churnam, they are mentioning for 6 months to 1 year, and now it has been increased to 2 years. But after using that, it will not be in a consumable form. Its efficacy will be gone, and the products included in the powder form will be. It's not healthier to consume it because the effect will be completely gone.
So you
Sometimes it may
recommend that follow the
produce.
labels and like, for example, Nellikai legium, if the expiry date is there, your recommendation is
Yes,
beyond that,
yeah.
do
You
not use
have
it.
to highly
Okay.
stick on to it. You have to highly stick on to the expiry dates.
Okay. Thank you. That was my question. Thank you.
Okay, ma'am.
Thank
Thank you.
you, Dr. Satyavati. Do we
Okay.
have any more questions for Dr. Satyavati? If we don't have any more questions, I take this moment to thank Dr. Satyavati.
Dr. Rama?
Yes, doctor.
Yeah, this is Sridharan again. If we have time, can I ask some questions?
Sure.
Yeah, Dr. Satyavati, you talked about PCOS, polycystic ovarian syndrome, which is a syndrome, not one reason why people have this. There's multiple things. And how do you, from the Siddha perspective, obviously with the PCOS, they may be coming to various stages. It may be during reproductive years or early. At various stages, they may come to. And the therapy for PCOS is complicated, and it depends on, since it's a syndrome, the symptoms you see in one person may not be same as other person. Like diabetes, you are going to look at number of symptoms which is exhibited in a lot of patients, but syndrome, it is multiple things you have. So from the Siddha medicine perspective, how do you treat PCOS? Take a scenario of any one, because you cannot talk about multiple ages. Take a, let's say in a reproductive years, this PCOS woman comes to you with multiple symptoms they have, some of the issues they have to deal with. What kind of therapeutic approach you take, or you may even talk about lifestyle change followed by therapeutic change.
Yes, sir. In their
Yeah.
reproductive age, when it comes to if they are getting married and they are they are planning for their fertility, then first thing I used to recommend is educate them and bring awareness about taking oil bath, having purgations, having a good lifestyle recommendation, and indulging their physical activity. The same thing. First, I will do all these things. And the second thing is medicine. And Siddha system of medicine, especially in a PCOS or any major problem with the endometrial thickness is not good, or there is a PCOS, or there is no rupture in the, there is no dominant follicle, or there is no rupture of the ovum at the right time. So for all these things, we used to recommend a purgative medicine, Malai Vembadi Thailam or Siddhadi Ennai during the periods, mainly on the first, second, and third day. But according to the patient's convenience, we used to recommend it from first day to seventh day. for 3 continuous days, for 3 continuous cycles. And along with that, specific times of specific kind of combination, medicine combinations, which could help them relieve from the symptoms and their process of reproduction and fertility. We will be prescribing medicines, sir.
So you have been successful in treating the PCOS in reproductive years?
Yes, sir.
No, good to know. Good to know. Thank you so much. Thanks, Dr.
Okay,
Rama.
thank you. Thank you, sir.
Thank you, Dr. Sridharan. Do we have any more questions before I close the meeting? One more. If you have any questions, please post in the chat or raise your hands.
Rama, Dr. Rama, I have a question. Do you have a few minutes after the meeting ends officially to talk to you while Dr. Rajagopalan is there and Dr. Satyavati about the osteoporosis discussion?
Sure.
Okay,
we can actually go out and come back.
In the same Zoom?
Yeah, in the same Zoom link. We can go out, all of us go out, end the meeting, and then we can join back. If Dr. Sridharan is okay.
Have a group call or something, Rama. It's better to have a WhatsApp group call.
No,
Sure.
this would work. We can come back by hitting the same Zoom link, Dr. Rama.
Yes, we can, or I can share a new link. It's no big deal.
It's better
Whatever
to have a new link. Yeah, better to have a new link.
If you can link us, that would be the best. Or if you want me to call back or go to the link again, I can. Whichever one is best, you can do that.
I will share a new link, Doctor. Thank
All
you.
right. Thank you. Thank you again. Thank you very much.
Thank you.
I think somebody raised their hand, Jagadish or something.
No, I think that was Dr. Shankari.
No, that's me. Yeah, I'm Jagdish from Chicago. I have a few questions to Dr. Satyavati.
Okay.
Yes, sir.
Yeah, it's a really great presentation. I'm happy to discuss further. And you mentioned all this dysmenorrhea, menstrual pain, and like as I asked the question before, endometriosis, which are not diagnosed properly because the lack of diagnostic blood marker. Only through endoscopy it can be diagnosed. And you mentioned that previously diagnosed endometriosis treated with Kalyana Murangai and for this. And this is like a ectopic endometrial tissue growth, and they respond during the every month menstrual cycle. And most of the women, they don't know whether they have endometriosis or not. But also this pain comes every month during the menstrual cycle. They think it's a normal. But this is like a 10% of women affected this endometriosis problem. It's about 190 million people all over the world, according to the WHO. So really, so I'm doing research at the University of Illinois about the endometriosis, and it's really if there is a potential drug in Siddha herbs and Siddha medicine, and that's really useful for women's health. It's not just a woman disease, woman's problem. It's a general problem because of this pain, and the mental stress will affect the whole family. And I think if you have really experienced the Kalyana Murangai or some specific herbs, I'm happy to collaborate. And also want for this audience, I want to share this main problem of this kind of endometriosis due to there's a more than 50% of women having anemia. They have this problem. So like you mentioned, the Madalai Manapagu is which is a Siddha iron tonic, helps to.
Speaking about the Madhulai Manapagu,
Yes.
so it is not like in modern physiology, they explain iron-rich foods and iron directly uses supplements to treat anemia.
Yes.
But in
Pre-
the system of medicine,
prevention
the
of
vision is not only about treating anemia. Whatever medicines we choose for anemia, say for example, when you are going for metal and mineral preparations like iron-related medicines like Annabedi Chenduram, Ayachenduram, or Ayakanda Chenduram,
yes.
they not only correct the anemia. It is only treating anemia is just like a byproduct.
Yeah, I think
But
that
it
helps, but
strengthens all the udar tadukal,
yes.
and for extra beneficiary effect, the anemia will also be corrected. That is
Yeah,
the thing.
I think the prevention of the anemia and correcting anemia will help, but it won't completely cure the endometriosis because it's already implanted and growing in their lower abdomen. And that's the problem. I think it's definitely there must be some Siddha helps to suppress the growth and or reverse and through apoptosis mechanism or some other mechanism. So basically I'm a Siddha doctor, so that's why I'm happy, you explained well. I really congratulate, and this kind of discussion need to go further. Thank you once again for everyone.
Thank you.
Dr. Jagdish, this is Sivasalam. Yeah, I think what I'll ask Rama to facilitate some further discussion between you and Dr. Satyavati to see what else we can collaborate on. So thank you for your comments.
Thank you, sir.
Yes, Dr. Jagdish, we can meet after the meeting or do something.
Absolutely. Thank you so much.
Thank you, Dr. Jagdish. There's another question from Tenmoli. Taking Kumari Pakvam both in menstrual and non-menstrual days, can you take Kumari Pakvam?
Yeah, you can definitely take it. It should be stopped during menstrual days. That is not the thing. It is just a healthy, it is a nutrition supplement like that only. It is just a nutritional supplement. It will not affect any, it's not like a hormonal medicine. It should be taken in these days and taken in those days like that. No, it is not like that. You can take it continuously for 3 to 6 months. It is just a food.
Thank you, doctor. Do we have any more questions? Now I invite Mrs. Sendamare Prabhagar, Secretary of Global Center for Siddha Medicine and Research, to give the thank you note. Thank you.
Thank you, Rama. We all know we had a very wonderful session today. This is a part 2 series in women's health webinars from GCSMR. As we already announced, we do this webinar last Sunday of every month. So already 2 parts are over. Still we have 4 more parts coming. Please invite your friends and others to participate in this wonderful webinar. Dr. Satyavati has been giving us all very important information, particularly for the women's health and how we have to take care of ourselves. And it's all very valuable information. We don't get it anywhere. And also we have forgot our traditions and our marabugal, that what to eat, what not to eat during these days, and the grandma's thing and everything is all forgotten now. At least we have this Siddha tradition is coming up, and it's been conveyed in a very proper, it's a medical system that's conveying us a lot of information. Please come and benefit from these webinars. We are planning all these webinars for all your health and well-being. So it's better for everyone to come and enjoy the meeting and take away all the good points that is very useful for our day-to-day life. Dr. Satyavati, thank you so much for conducting these webinars and accepting this series of webinars for us from GCSMR. We value your time. I know you will be very busy with your clinic and other hospitals, but you gave us time for giving this presentation and patiently answering all the questions. Thank you so much. If you have any questions like from Jagadish and others, please, I have shared the email for us, contact@gcsiddha.org. Please contact us anytime. We have different groups, and also we have scientific advisory group we can all discuss. And if you have any suggestion for next webinar topic, please don't hesitate. Contact us if you have any questions, or if you would like to have any health webinar and a specific health topic, please contact us. Please let us what to do. And we have one more coming in next month, that is August 30th, I think. Yeah, August 30th on Sunday. Please keep tuned for us, with us, all this information. Thank you so much, and thanks for joining.
Thank you, Tamarai. And before finishing, we are a nonprofit organization, and we rely on donations and support from all of you. So please visit our website. I shared the website information in the chat. Visit the website. There's a knowledge of information available in the website. Our proceedings, advances, activities, everything is there. So you can view it, and please donate whatever is possible to you, whatever you can. So I take this time again to thank everyone for joining and giving your valuable time. So we will meet next webinar on August 30th. Thank you very much. Until we meet again.